Thanks for joining us. Today we're going to be talking about heart disease and specifically how it affects women. And joining us today is Dr. Beverly Hills, a cardiologist from Beverly Hills, who's assistant clinical professor at the UCLA School of Medicine and also director of the Beverly Hills Institute of Cardiology. Thank you so much for being with us today. Tell us a little bit about what you specialize in at your practice.
Most cardiologists treat sick patients with heart disease. We do that, but we specialize in preventive cardiology.
And what is preventative cardiology?
We now have very sophisticated technology and blood tests that allows us to detect heart disease at its very early stages. And that allows us to implement a program where we can prevent heart disease before it starts.
I understand heart disease actually kills more women than men. Why is that?
Well, heart disease is the #1 killer of women in the world. It kills more women than all cancers combined, including breast cancer. And there are many reasons for that. A woman's heart is different than a man's heart. It's smaller, it's more delicate. But the main reason is because the symptoms of a heart attack can present very differently in women than men.
How do signs of heart disease present in women?
Nausea, indigestion, heartburn, shortness of breath, neck pain, jaw pain. And so you can tell it's very difficult to diagnose heart attack in women.
And what are some of the risk factors where a woman might know that she is at danger of having heart disease?
High blood pressure, diabetes, high cholesterol, smoking, and family history. Also, obesity and inactivity play a major role in causing heart attack or stroke.
And at what age should a woman start to assess her risk factors?
As early as possible. The disease process starts 20 or 30 years before the actual heart attack. Late teens or early 20s would be a perfect time to start looking at the risk factors.
Is a heart attack preventable?
Absolutely. We now have the technology to detect heart disease, and by using lifestyle changes and supplements, which is a major part of my practice, we can prevent heart disease before it develops.
Tell me about some of the new state-of-the-art tests that can now be done to detect heart disease.
By using a simple blood test, we can assess your risk of heart attack or stroke within the next 10 years. We can also use sophisticated CAT scan or ultrasound to look at the actual arteries of the heart or carotid arteries and detect heart disease at its very early stages.
All right, doctor, thank you so much for joining us. You've given us a lot to think about today. Thank you.